Hello, I'm Dick Corsell, and welcome to Community Care Network Connections. Community Care Network is the parent organization of Rutland Mental Health Services and Rutland Community Programs. And today, the topic of our show is on adult outpatient programming. And joining me today are Mike O'Brien. Mike is the Director of Adult Services for the outpatient program at Rutland Mental Health Services. Kathleen White is the Clinical Mental Health Counselor for the Adult Outpatient Program. And Barb Roberts is the Supervisor of Adult Outpatient Services and also a licensed clinical mental health counselor yourself. Right. So thank you and welcome to Community Care Network Connections. Now, Mike, you actually have the distinguished in the fact that you were our first guest along with our CEO Dan Quinn on the very first CCN Connection show when you talked about emergency services. So about a year later, you're here to talk about another program of Rutland Mental Health Services, and that's the Adult Outpatient Program. It's a program that's growing. There's a community need for it. So during today's show, we're going to learn a little bit more about that program, why it exists, the people that you serve, the types of work that you do, and how important it is to the community. So let's just start with you and have you tell us a little bit about the Adult Outpatient Program at Rutland Mental Health Services.
Well, thank you, Dick. The Adult Outpatient Program is part of a number of services that we have for adults at Rutland Mental Health Services. And it's at our 7 Court Square location, right off the park where the gazebo is. And we serve adults who have primarily mental health needs, though an awful lot of people that we see also have substance abuse problems as well. And we provide an array of services for individuals who may be struggling with mental health, emotional problems, who need some assistance and finding that they're just not able to manage on their own, or that their life has been going in such a direction that they need some additional help. And so we provide a number of services. We have groups that people attend to get help and assistance. And we've just hired a case manager today. Actually, she's starting today. And to provide some assistance to individuals in our community who need some help, who may need help finding housing or getting services and aren't able to do that on their own. So it's a program that basically serves the mental health and substance abuse needs of anyone interested in receiving help.
Let me ask Barb, why is it important for an agency like Rutland Mental Health Services to offer adult outpatient services? I mean, why is this an important function of an agency like Rutland Mental Health?
One of the things we know is in Rutland there are not enough outpatient therapists in the community to serve the needs of the people who are in the community. So we serve to pick up kind of sometimes it's more difficult people, sometimes it's people who have co-occurring disorders, which is mental health plus substance abuse, which a lot of regular individual therapists in the community aren't able to manage. We also have a prescriber on site, so that's an additional need that an individual therapist would not readily have access to. So those are some of the reasons that it's important for us to have our program and be available for adults in the community.
Well, I was just going to say, yes. We also find that sometimes people with Medicaid or VHAP insurance sometimes, not always, have a harder time getting into community providers. So that's another void that we can fill quickly for people.
So let me ask you, what would be a reason, and Mike had talked a little bit about that somebody would seek the adult outpatient program? How would they get to you? You talked about the individual, private practice therapist, and both of you are licensed clinical mental health counselors and have had years of experience in that field. where would these people come from? I mean, why would they come to
Everywhere.
you? Where would they find you?
It's true.
They do come from outpatient therapists. They come from people who are in crisis, come to the emergency room, get screened by a crisis clinician. Mike is the head of that program as well. So they come from there. They have been referred from hospitals like McLean in the Boston area. They have been referred from hospitals in New York. Sometimes we have students, who are in college in another area, but their parents live in Rutland and they come back here to get help. So we have referrals from a wide range of other services. We certainly get them also from Evergreen, who maybe Evergreen is treating a person for substance abuse, but then they also need some mental health services. They come to us. We get referrals from hospitals, from certainly the Rutland Regional Hospital, people with some mental health difficulties. So we get them from everywhere.
But people can call up themselves and come to the program too.
Mm-hmm.
They can contact our intake office if they are interested in services. They don't have to be referred by anybody.
And that number is 775-2381 if anyone is interested in either finding out about that service more or calling to enroll. That's the number to call.
And it is something I know that we do want to promote more of, because there is a significant need in the community. I mean, we're hearing more. We're going to be doing shows in a few weeks, actually, about the drug problem in the Rutland area and on the opiate addiction issue. And so we know that there are growing needs in the community, and we've had many shows. We've talked with different providers within the Rutland mental health family and collaborative partners in terms of many stressors that individuals and families have experienced over these past few years, in particular during very difficult economic times, which we know can be significant mental health stressors and cause lots of other problems. So anyone then can access this particular program. Now, one of the things that was talked about earlier that I'm interested in, and I'm sure others are, is this concept of working with groups. And I know that we're in our substance abuse program, and certainly in a lot of the treatment modes for substance abuse, the group model is very effective. Can you talk a little bit about the group model, Barb? I would imagine that some people at first may be very hesitant about, well, my problems are very personal.
Right.
I'm not going to be comfortable sitting amongst a group of people that I don't know and spilling the beans here. I mean, how is that group model used in the adult outpatient? Why is it important, and what are some of the benefits for people? And Kathleen, I'll be very interested also as you as a mental health counselor to weigh in on that as well.
I'm very passionate about groups because I have seen the benefit firsthand over and over again. And just today, another person, it happens almost every day, another person said, when I come here, I know I'm not alone. And that is so huge for people to come and, with their very private personal problems, share them and get them reflected back by other people who have had or do have similar problems. And it is so helpful for people to hear. Additionally, we teach a lot and use the group as part of the teaching. And sometimes, and we've talked about this briefly here and there, people in the group can do a better job of confronting another group member in a kind way than we can, because the clients will sometimes hear it better from a peer than they will from us. So a group is very effective in that way, just kind of supporting, gently confronting, in a way that's very healing.
I agree. I think too, people can give each other feedback and ideas for dealing with problems. And they're ideas that we don't always, we're not always going to think of ourselves, and they're ideas born from their own experience. So it's very powerful. I agree with Barb. I came to this program because of the groups, because I really believe in them.
When is, Mike, please.
I just also, one of the things that we see, we send people from the emergency room oftentimes who are in crisis, is that people sometimes feel isolated in the community and don't have the support when times are difficult. And there's something about going to a group that can be very supportive. When you have a mental health problem, sometimes there's people bring shame with them about having these problems. And it's difficult to talk to family members sometimes about your problem or others because they just don't really understand. They might not be educated, say about depression or some other mental health problem. But when you're in a group with other individuals who experience similar things, my experience has been they tend to understand much better than the average person on the street. And the acceptance for some people really makes a difference when people feel that other people understand what they're going through and accept them. It can be really the best medicine sometimes, besides, some people do take medication as well. But this type of approach, it can be very powerful in terms of getting people to the point where they can get back to their lives and start moving on. So as you can see, all of us really have seen this in action, and I would encourage anyone who is feeling a little skeptical about a group to really give it a try, because we find that when people first come, they tend to be a little quiet and listen, which they should. But then once they see that there are others in the group that understand and are friendly and that it's a safe place, people tend to open up, and that's when the real good work starts happening. And these folks are terrific in terms of helping people in a very nurturing way all along the way as people start to open up and talk about what's on their mind.
So that model is very important, and we've heard that. Certainly we know that in the substance abuse, and it's important in education and lots. When do you recommend, do people start out in groups in the adult outpatient program? Do they start out individually, or is it sometimes a mix? When would that be indicated?
Pretty much people start right from the beginning. They meet with one of us individually to do an evaluation to make sure they're appropriate for the group, to diagnose, find out what their stressors are, and then they start the group pretty much, within the next few days based on their schedule, their needs. There's, like Mike said, people may be a little hesitant in the beginning, but they find pretty quickly, if they show up, give it a try, that they like it.
I just want to add too, I think another concern people might have about groups is, especially in a small community, is confidentiality and privacy. And we really do emphasize that and review it regularly to try to keep the group feeling like a safe place for people.
And that's very important, and you're right, in a small community. Let me ask Barbara, how do you help people with more significant mental health issues? Because it sounds like you are able to accommodate a wide range of issues of maybe adjusting to perhaps a temporary life trouble or some separation or loss, right up to more significant types of mental health issues. How do you identify and how do you work with people that have more severe issues, and how do you serve those people in an outpatient type program? When
we do the evaluation, we're starting right then to build some kind of a working relationship with them, and that's key to have that and to have that supportive relationship in place. And then we are working very closely with others in the agency. As I said, we have a prescriber. We're working closely with him. We're working closely with other clinicians in the agency in terms of what that person's needs might be going forward, because we're always thinking about what's the next step for this person. Additionally, a lot of people, regardless of their mental health issues, can really take advantage of skill building. So we are constantly working on skills with our clients. Right now we're working on some stuff about making and keeping friends, because a lot of people have struggled with that. struggled with relationships that seem to explode in their faces. So that is something that a wide range of people might benefit from. So we're always teaching as part of what we do, and teaching people ways to manage their symptoms. If it's depression, if it's anxiety, what are ways to manage aside from the possible medication they might be getting.
There is structure to the group, so that helps. Mm-hmm. It's not a kind of free-flowing group for 2 hours. And I think the other group members that may be a little more stable are also helpful to that person as well. Mm-hmm. So that makes a difference. Mm-hmm.
I'm sure also being part of a large integrated agency is very helpful, as you said. I mean, we have from psychiatrists or prescribers, mental health clinicians such as yourselves, case managers, social workers. We have a wide range of skill sets that can be brought to bear, and I would imagine that for some people with perhaps some complicated issues, that would be necessary, because in private therapy or the private practice, perhaps that integration is just simply not available.
And we can refer people on to programs that can serve their needs more long-term too. Mm-hmm. So we kind of sort that out as we're working with people. I'm
going to ask Mike, because we talked about this actually when you appeared the very first time, and in that role as Director of Emergency Services, we talked a lot about emergency mental health, and in particular the collaboration and the relationship with Rutland Regional Medical Center. But on shows we're going to have coming up, we're going to be talking about substance abuse issues specifically. Many people, and you said at the beginning, that have mental health issues also present with co-occurring disorders. They also have a substance abuse issue. Talk a little bit about that and how that complicates things perhaps, or how you address that, because I would imagine that creates another level of complexity than perhaps somebody whose trouble or issue at the time happens to be very one-dimensional. Could you talk a little bit more about that?
For a long time, we used to treat people just with mental health or with substance abuse problems over the years. And in the last decade or so, we're finding that a majority of the people that we see for treatment have both. And usually people who are having emotional difficulties often will use substances as a way of managing those feelings or dealing with the mental health problems that they're having. And so by the time they come to our program, we recognize that not only are they experiencing depression or anxiety, but they also maybe have developed an addiction to chemicals, either alcohol, over-the-counter medication, prescription medication, and they may recognize that, and they may not. And through the process, part of what happens in the work that we do in the adult outpatient program is to do a thorough assessment to try to look at what are the things that's going on in a person's life that may be contributing to some of their current problems. And through that assessment process, which starts before someone starts and continues throughout the process, we will help people look and identify what are the things that may be contributing to the current difficulties that they're having in their life. And if it appears that there's some substance abuse issues going on, we may ask them to get a substance abuse evaluation by someone who specializes in that, just so that we can get some clarification and some more information that's going to be helpful for that person to ultimately get their life back and move on to the goals that are really important to them. So it can be a little tricky at first until we get to know someone to help them sort out what the issues are. But over time, we have, for instance, we have a substance abuse counselor who's working in our program right now with us that we use and helps us, because our background is primarily in mental health. But over the years, through trainings and so on, we've learned how to help diagnose and treat people who also have substance abuse issues.
Well, in fact, we're going to be starting a group soon called Seeking Safety, which is a group specifically designed for people with trauma and addiction. So it's a co-occurring group. And that's one of our goals, is to be able to treat co-occurring conditions. Doesn't mean we don't refer people to evergreen substance abuse services if we really feel strongly that that's got to be attended to. But we do try to meet people where they're at, too.
Let me, since we're talking about that, Barb, have you talk a little bit about who else you may work with in the community, because Rutland Mental Health Services works with a lot of collaborative partners, community partners. Because this work is often so complex that it cannot be singularly done by any one agency or any one provider. Who are some of the organizations, or some of the organizations, people that you actually work with on a regular basis to bring even more resources to help folks in the adult outpatient program?
Well, the list is kind of almost endless because, it can be anything from folks at probation and parole to folks at voc rehab to working with people to make sure they're showing up at their appointment at Asa Bloomer for whatever services they might need there. Working sometimes with other, certainly folks in the agency, child and family services perhaps. We're sometimes working with parents of children who are in services there. We're working certainly a lot with staff at Evergreen around the co-occurring needs, and sometimes private practitioners, sometimes, we're seeing their client for a stabilization period, and then they will go back to that individual clinician. So we run the full gamut of collaborating with people in the community.
One of the things that makes us unique is that we are experts in treatment of mental health problems. And in the community, you'll find a vast array of private providers that provide lots of counseling. But we have obtained specialized training in a variety of treatments that you cannot find anywhere else in the community, like DBT, which is a treatment for people with personality disorders. You're not going to find that treatment in the community, but you will find that at our community mental health center, and we use that in some of the groups that we're doing. And so part of coming to our program, you're going to be assured that first of all, that we're CARF accredited. We're an accredited program with a national accreditation, but we also provide some unique and skillful programs for individuals who may have been in treatment in other places before and have been unsuccessful, but when they come to us, they have an opportunity maybe to get some treatment that they haven't experienced before that would better suit their needs and help them move along.
And I have something to add too, and the fact is that I only know one private therapist who does groups in the area, and she has had long-term groups, 2 groups, that she's worked with for years. I know another provider who's done some group work, but we're doing something that just isn't really available in the community beyond us, and it's a shame because it's such a valuable tool.
Right. Mike, I want to ask you, everyone is aware, obviously, that Vermont State Hospital closed in Waterbury, and there's been a lot of attention placed on the strain that closure has put on the local systems of care. How does the adult outpatient program at Rutland Mental Health Services help in some way alleviate the burden on the local system of care in particular in light of the closing of the state hospital?
Well, as everyone knows, Hurricane Irene devastated our state, and particularly it wiped out the state hospital, which has been in the news quite a bit recently. And as a result, the state has had to find locations for patients. There were 54 beds in that state hospital, and patients were moved around the state, some of which are here in Rutland as well on our psychiatric unit. And so the response from the Department of Mental Health has been to re-examine the care that's being delivered in the state for people with mental health problems. And there's been a realization that there's an opportunity here to do some very innovative things that can help people with more community-based treatment. So right now there's an initiative around the state. We heard the Commissioner of the Department of Mental Health, Patrick Flood, discussing on Monday that they're going to be dumping $20 million around the state to provide community-based care for people, while at the same time creating inpatient hospitalization, but trying to provide a more friendly community-based treatment by increasing residential beds. So we've been asked by the Commissioner to do three things in terms of helping people in our community, but also to provide improved services at a more efficient cost. We're being asked to find ways to better utilize our emergency room, which, as you know, around the state and around the country, emergency rooms have become treatment centers that they're just not designed for. And so we're looking for ways of creating services in the community for people so they don't have to wait long times, which sometimes happens in the emergency room. So we're developing a crisis center. We're hoping it's going to get funded. We haven't heard yet about the funding, but where people can go somewhere else other than the emergency room. You know, if people need to be in the emergency room, they should go, but we're hoping that there's a lot of people that go to the emergency room whose needs can get met in the community. And that also means looking at our outpatient department to see how we can help support people so they don't end up in the emergency room or in the hospital and reach them earlier. So we're looking at developing, strengthening our crisis team to have outreach to people in their homes, and also providing groups based on the needs that we discover as we go along. So our adult outpatient program is designed to be flexible and nimble so that we can adapt and adjust to the needs that we perceive in the community. We can get people in rapidly, we can give them the support that they need, and hopefully get people stabilized much sooner than used to happen. So our area has been promised some funding for some of these programs. We may hear in the next week or the next month about the funding, and we're cautiously optimistic that that's going to happen, and that we're going to be working more closely with the crisis team to be able to identify people and give them help and support early on so that they might not need to go into the hospital.
Mm-hmm.
I think that's a very important consideration, is the fact that the agency is responding to changing needs and being flexible, and the state has a lot of difficult decisions it has to make, in particular around the difficult economic times, but the adult outpatient program at Rutland Mental Health Services certainly is addressing many of these very critical needs, and as we've heard, is a very important resource for this community. So I want to thank you for being on Community Care Network Connections and talking about the adult outpatient program. So Mike O'Brien and Kathleen White and Barb Roberts, I want to thank you. This has been very enlightening, and I hope people have learned something more, and certainly contact Rutland Mental Health Services if you want more information on the adult outpatient program. So I'm Dick Corsell, and you have been watching Community Care Network Connections. Thank you.